Hi YouTube, I hope you're well. Today I'm going to talk about 10 of the main points that I found in the CAS review from the summary document at the start of the CAS review. Dr. Hilary Cass was appointed by the NHS in England in 2020 to review the treatment of young people questioning their gender. I can't remember the exact title, but that's okay. You've probably heard of the CAS review. So Dr. Hilary Cass is a retired consultant paediatrician and was also the former president of the Royal College of Paediatrics and Child Health. So my name's Sally. I'm a counsellor in Australia and I work with people who are making changes to their behaviour or who need some help with what they're going through in their life at the moment. If you'd like to book in, you can go to my Instagram at Studio China and direct message me and we can set up a chat. So I've highlighted quotes from the CAS review and I just want to run through a few of them. The first one is about in this area, there's a lot of strong and widely divergent opinions. And unfortunately, the evidence base in relation to the use of some of the treatments, the current clinical approach, has been shown to be weak. Next point is that because there's such widely divergent opinions, there's actually quite a polarized public debate, which doesn't help the people who are suffering these symptoms and also their carers, their parents and the clinicians who are trying to treat them. There's been a real growth in referrals in the area and a changing epidemiology. So how the disease or the condition used to present has been changing. So there's a massive increase in the number of girls being referred into the service. And because the clinical approach is so different to the traditional approach that had been used, usual clinical practice, some clinicians are fearful about working with gender questioning young people, which isn't a good situation for people needing treatment. So what Dr. Hilary Cass found is that, and I'll quote here, there are children and young people, families and carers all trying to make sense of their individual situations, often dealing with considerable challenges and upheaval. So this is what we currently have. We have families really struggling with this. And a couple of the other points that Dr. Hilary Cass made are that young people are often known to change their views of themselves and their sense of identity over time. So these things are not really fixed and they will evolve. One other quote here, and I'll quote here, whilst some young people may feel an urgency to transition, young adults looking back at their younger selves would often advise slowing down. So in terms of the overall treatment for these people, the review found that for some people the best outcome may be transition. Others can resolve their distress in other ways. Some people who do transition do go on to regret and then detransition or retransition. And really, Dr. Hilary Cass was saying that the NHS has to be able to support and treat all these different presentations without some sort of, what was the word that she used up here? Without this toxic and ideological public debate, which doesn't help in how to look after these people who are not doing well. And so the treatment will need to be holistic and personal, so a real client-centered approach. And it is going to involve a number of interventions and services. And remember that when the CAS review came out, the Tavistock Clinic in the UK was closed down. But this is an area where there's going to be a lot of people, and currently a lot of people needing treatment, counselling for their families, for the clinicians who are dealing with this new cohort of clients or patients who didn't exist previously. And the problem is that primary and secondary care physicians are concerned about they have concerns about their own competence in how to treat this cohort, and that because of the debate surrounding it, people are fearful to talk about it. So this is really not a good place to be. So we need to be able to freely talk about how to manage and treat and care for these people, these children and their families. So it's definitely an area that's of concern to me, and part of my reason for making the video is that I want to be involved in talking calmly and openly about these problems. This is obviously Dr. Cass's findings from the Cass review in the UK. I know that there's currently an investigation, a review in Queensland, and there's also a national sort of looking at the evidence. But while we wait, in the meantime, these problems don't go away. So I hope you found this useful. I'd love to hear your comments, and it's really about just trying to help these people these families, these children, these parents, these clinicians who are going through a difficult time in managing to care for these clients. All right, YouTube, bit of a somber topic today. I hope you found this helpful. I wish you well. Bye.